such facilities are onboarded as COVID vaccination centers. We have also shared with you that vaccination in private facilities will be charged subject to a financial ceiling, whereas vaccination in government facilities is totally free, the cost being borne by the central government. In yesterday's meeting, we had trained the senior officials, that is additional chief secretaries of health, secretaries of health, and other officials of the health department, MDs of National Health Mission, as well as the district immunization officers and their teams on the working of COVID. Our colleague Vikas Sheel had shared that the details of COVID version 2.0 yesterday. Again, today we will be answering your questions on that. So we need to have quick and frequent meetings, and offline also, if you have any issue, you can either get in touch with me or with ASNMD or with Additional Secretary Manohar Agnani or with Joint Secretary Vikas Sheel and their teams. You need to have quick and frequent meetings not only with us but also with the centers, both public and private, that will be serving as COVID vaccination centers. In today's meeting, we will be discussing 6 issues, and we will be discussing and answering all your queries on that. The first issue is the charge per dose to be recovered by private hospitals. The second related issue is the electronic and the financial management mechanism in this regard. The third issue is user names and passwords to be provided to the private facilities to enable their quick onboarding onto CoWIN system. The fourth issue is mapping of private facilities with the nearest cold chain points to ensure seamless flow of vaccine to them. We have also shared with you the vaccine allocation plan for each state. So it has to be then further reallocated to public and private facilities in an equitable manner. We will be discussing with you the 3 means of registration, which is advanced self-registration, online registration, on-site registration, and facilitated cohort registration. What we will be discussing today is that in the first week of March, given the total number of COVID vaccination centers that a state would have, whether you would emphasize a particular mode for optimal utilization of your facilities, whether you would be focusing on all the 3 modes. So what are your plans going ahead? Because we were given to understand by Madhya Pradesh, and I hope they are here today with us, that they would in their rural and peri-urban areas focusing on facilitated cohort registration, which is a kind of on-site registration, but it is on-site registration of a group of people who are actively mobilized by our teams in the field. And when I say our teams, it means our Ashas, our ANMs, Panchayati Raj workers, so on and so forth. So you need to share with us the plans of utilizing advanced self-registration, on-site registration, and facilitated cohort registration. The last and 6th point that we will be discussing with you is the simplified comorbidity certificate that we have evolved and have shared with all the states and UTs. It's a 1-page certificate which can be given by any registered medical practitioner. It specifies 20 different kinds of comorbidities, and the registered medical practitioner signs it, gives his registration number, and if the beneficiary is tech savvy, the beneficiary uploads it on the CoWIN, scans and uploads it, or keeps it in his smart mobile and uploads it. Or if the beneficiary is not tech savvy, then he or she carries a hard copy to the vaccination center, shows it, and then gets vaccinated. So these are the 6 points on which we will be discussing and trying to resolve your questions and queries, if any. So having made that opening statement, I would now request ASNMD to specify certain specific guidelines that have been issued yesterday and today and have been shared with the states, and then we would discuss state-wise suggestions and questions. Thank you.
All right, well, that was the Health Ministry there talking about the vaccination drive and the modalities going forward beginning on Monday, and the meeting which is going to be held today will discuss important issues such as the pricing of the vaccine, a call on which will be taken, the seamless flow of vaccines to both the private and public facilities and government facilities also to be discussed, the entire comorbidity certificate and how that will pan out and which are the comorbidities that will be included. That is also something that is going to be discussed. So very crucial meeting ahead of the second phase of vaccine drive going to be held over all of these issues.